Right, hip impingement or FAI syndrome rehab exercises. Here are some simple ones that you can do in your rehab exercise plan at the gym or at home. Let's go. So FAI syndrome, or hip impingement as it's better known as, often will present with symptoms around the front of the hip. Sharp pain, catching pain, giving way, sometimes clicking, and it can be really hard to rehab. Now, it's really important to underline all this stuff with that this video is to support, inspire your exercise choices and be a bit creative and give some guidance in regards to how to manage it. It's never a one size fits all. Some of the things in this, some might find easy, others might find too difficult, and others just might not be able to do it. But it's a nice starting point for some of the rehab choices that you can do, and you can progress it and, you know, let it go from there and see how it guides your rehab. Now, it's really important to consider that people who have FAI syndrome, or kind of the hip impingement at the front of the hip, will often find that as a result of sometimes a labral tear in particular, they might get pain that's inhibited into certain ranges. So it's painful and restricted because it hurts, but also painful and restricted because it's stiff. Let me explain. So often what patients or individuals with this will find is that bringing the hip into deep flexion can be quite sore. So saying things like getting on a bike or sitting or driving can sometimes provoke it. And also we'll see a loss of internal rotation, which is when the hip's going outwards, and that can be quite provocative. Now, that's not to say that we avoid all these things forever, but when you're trying to rehab something that's painful, we don't want to necessarily start driving into the thing that's painful, and probably makes a bit more sense to work around it. Now, I find these three exercises for me work great. I've been, dealing with hip pain with patients for more than a decade, and I find that some of the more staple, simple ones are a great starting point to help patients. So use this and progress it. But like I said, there's never a one size fits all. But I want to talk you through it. I mean, for the first one, we're going to go through my staple, the staggered sit to stand. Now, the staggered sit to stand is a great point to progress, because sometimes for some, the sit to stand, which is like a box squat, might be just a bit too easy. Now, if someone's doing a box squat, even here with this amount of hip flexion, and it feels comfortable and probably a bit too easy, but doing an actual full body squat is too difficult or painful, then we can start to progress things a little bit from here. So the progression would be this staggered foot position. So you'd kind of have one foot back, one foot forward, and we start to bias this leg a bit more this way. Now, ideally, the target would be a single leg box stand up and then back down. That would be on one leg. But that's a big jump from two. So you'd start with a staggered stance like this, have your heel on one foot kind of in line with the toes of the other one, arms crossed, and just drive up. Sorry, hit the mic there, so down, and then all the way back up. And see how that feels. And don't worry about sitting down. The sitting down is there purposefully to support you, purposefully there as a little bit of a guide, because this actually is hard enough. Now, sometimes this might be too easy, this might be too hard. Now, to bridge that gap, you would just put something on here and just have your starting point probably a bit higher up, whether it's a couple of weight discs, even if you have something at the gym, like you could use one of these, like a weight disc that you could just pop onto the bench, so it's a little bit higher up. And then the angle here has opened a little bit. So you're starting to bridge the gap and find the sweet spot for something that's not too easy, and also something that's not too hard. So that's a real good, great starting point exercise for me, and actually really great at building single leg strength, stability, and good tolerance to load. Let's say that gets even easier. You can easily progress that further by not necessarily just moving the height and bringing it back down to here, but holding a light weight in your hand, a disc, a 2 kilogram or something like that, where you can still keep the same foot position, keep the same height, but load with a weight rather than having to just go to one leg, and see how you get on with that. But like I said, a great opportunity to have a good exercise that gives you a little bit of scope to progress and regress relative to what your needs are. Right, exercise number 2 for me is working a little bit more on stability. Now, a fantastic tool is using like these airplanes, right? But sometimes they're a bit too hard for patients to do, especially in the early phases. But we don't want to neglect single leg stability exercise. So what I find quite useful in this situation is this one. So balance on one leg and actually have the rear foot resting on a bench, almost like how you would do like a split squat. Slowly hinge, but not too much. Remember, too much of this might be provocative. So find the sweet spot that you can find a hip, hinge a little bit, and just slowly pivot on this hip. Now this foot behind me on the bench is giving me that additional support to allow me to focus on just this. Now, as I do this, although there is support on this leg, this is all starting to burn up. This is working what I want it to work. And actually the progression obviously is doing it on one leg, but that can be quite challenging to control and also hard to do a higher volume of in those early stages. You could equally do the same thing and just have your foot up against the wall for support, but whatever you find works best for you, have that support from something behind to allow you to really control the flexion and the pivot. Now remember, I said to you at the beginning, rotation of the hip internally might provoke it. So if I was going this way, it might pinch, it might catch, it might hurt. So for the starting point, I would just focus on going down a bit and opening that hip up, really feeling it fire around here. And if you are feeling it there, then you're on the money, you're doing the right thing and you're feeling it in the right place. Don't overanalyze things too much. Don't be too critical of like, my foot is going in a little bit, my knee, my ankle. Like, just do movements that feel confident, natural, and you're doing it properly. The third one is trying to reintroduce some sort of hip hinge, right? So I'm going to bring this weight here. Don't worry too much about the weight to start with. People who have hip impingement often find that hip flexion, hip hinge type movement can be painful. We said that at the beginning of the video. This is a nice intro to be able to allow someone to get used to doing that again without the full movement. Now often what I would do, start with a weight of a decent weight relative to what the person normally lifts on a bench in front that's at a modified height. And here I would just literally do a pick up and then drop down. So we're just working in that top range with load, but also modifying the angle that we're going into trunk and hip, hinge flexion type movements. I'll bring this side on so you can see how it looks from the side. The back position wants to be, I guess, how you would traditionally do like a deadlift type movement. And you would just want to kind of stick your butt out, pick it up and stand up. Slowly down and then back up. So you want to modify range, modify height, and just pick it up. And obviously the progression from there, the great thing with this, we can start to do a staggered stance and start to, again, work within the same range, but bias one leg more. And all these exercises are doing, aside from building strength, conditioning, whatever it might be, also making someone feel great that they're doing exercise, allows the hip to start to move and become more tolerant to certain positions that possibly over a period of time, it started to maybe drop, or you've neglected it, or it's just been a bit too difficult to do. And then just a quick recap. So we had those 3 exercises, the staggered sit to stand, we had the modified single leg stability and twist, and then we've had that last one, which is the modified hip hinge. All of these should be nice exercises to start with, but equally progress as needed. The key thing to consider here is, if anything hurts, make sure that you don't push through pain. Always try and get support from a healthcare practitioner so they can support and guide you. I would be reluctant to say put all your focus just on social media exercises that you find. Has to be bespoke to your problem. You need a bit of guidance and tailored guidance to what you want to do. And obviously, I'm keen to hear from you guys. So comment how you found the videos. And also, if you want other specific rehab videos, I'm only going to know about it if you put it in the comments. So let me know.